Okay, let's jump right into it. For this first episode, I am going to dive into the topic of TRT. That's testosterone replacement therapy. I'm going to cover the basics that you need to make an informed decision for yourself and or look really smart in front of your friends who may be considering it or are even already undergoing treatment. So let's start with just testosterone. What the hell is it? Testosterone is simply a hormone present in humans and many other animal species. Both men and women use it in their physiology, although men tend to have levels anywhere from 5 to 20 times more than women do. As men, we primarily produce testosterone in our testicles, whereas women's bodies produce most of the T in their ovaries. During puberty, our T levels shoot up significantly, which causes our sudden onset of seemingly persistent interest in the females around us. The surge of T throughout puberty also leads to muscle mass and bone density increases, deepening voice, facial hair, and, of course, industrial-grade morning wood. Once we get through puberty, our T levels fall off and normalize, stay relatively consistent until we hit about age 30, and that's where the problems begin. At this point, testosterone begins its perpetual decline of roughly 1% per year in males. So maybe you've heard about how testosterone levels in men are lower on average than they were a generation ago. And for the most part, this seems to be true, and we'll get into the why of that a little bit later in this episode. So now let's jump into the therapy itself. As I mentioned in the beginning, TRT stands for testosterone replacement therapy. So why would a guy want to look into this or get on it? It primarily starts off with them becoming aware of symptoms that they have and the potential for this treatment to fix them. So probably the most common one would be a low sex drive or libido, even erectile dysfunction in some cases. Another common complaint might be low energy or reduced muscle bulk and strength, increased body fat. We see that almost everywhere, it seems. Also, recovery from working out or athletics seems to take a lot longer, and soreness seems to last for more days than it used to when we were younger. Depression is another common symptom that can be related to low T. There's also poor concentration, infertility, and even loss of body and pubic hair. So, definitely some big issues that would make anyone want to look into fixing them, especially if there's a therapy out there that can pull it off. So let's say you have some of these symptoms and you've, as recommended, looked into ways to fix them naturally, because there are some things that we can do that will naturally bring up our testosterone levels. One of the biggest ones is weight training. Can have significant impacts. Also, alcohol consumption, it can cause a decline. So especially, if you're just having beers once in a while, or maybe on the weekends, or, at special events, it's probably not the cause of your low T. But on the other hand, if you're drinking, every day, and the only time you take a day off of drinking is because you're super hungover, then that would be a really a strong option for a natural way to start to bring those testosterone levels back up into, I guess, a normal range for you. So let's assume that at this point you've looked into some of the natural ways to raise your testosterone, and we'll cover those in more depth in a little bit. And say you're looking into getting the therapy. The first step is really, I guess, you got to find a place that will prescribe it to you. So that could be your general practitioner. It seems that a lot of people actually just go to a men's clinic that specializes in this kind of thing. And if you've already kind of made up your mind and you know that you want this, it seems that the consensus is usually that your general practicing doctor will maybe kind of discourage it, depending on who he is. Whereas obviously the clinics that specialize in this are going to, for the most part, be on your side and help you get on the therapy. But before anybody, at least in the United States, can legally prescribe it to you, they do have to get a blood test from you or draw blood from you and then submit it to a laboratory for testing. And here's where one of the first set of challenges come in. There are a lot of issues with accuracy when it comes to the blood tests. There's a number of different ways, or assays they call it, to really attempt to determine what your actual levels are. So for example, you can test the free testosterone in the blood. You can test the amount that is bound up with sex hormone binding globulin or something like that. Testosterone also binds more weakly to a couple other things in your blood. So anyways, you get the blood test and you get your levels, and there's a range that, at least on the test that I took, says it's based on an average of males aged 19 to 39. And I think it's nanograms per deciliter. But the range is roughly 240 to 960 or something like that. So if you're on the low end of that range, then you may be a candidate for testosterone therapy. And as you're at the upper range, then you may not be. The problem is our levels fluctuate throughout the entire day. Testosterone is usually highest in the morning. So if you're trying to get your medical insurance to pay for it, they usually require that you take the blood test before 10 or 11 a.m. because they want to see what your levels are at the highest point. If you're going to pay for it out of pocket, like if I were to get on it, that's the way I'd be doing it. When I first looked into this in early 2020, I was mostly convinced that I was going to try it out. And so I didn't even try calling a regular doctor. I called a clinic and I scheduled my blood draw for 3 p.m. in the afternoon to ensure that I would probably have lower values in my blood and thus could get prescribed if I chose to go that route. So your levels fluctuate a lot throughout the day. There's also some medications will suppress your T. And when I say T, I just mean testosterone. And, I don't want to say it every single time. So some antidepressants, common ones, SSRIs like Prozac and things of that nature, they can have a suppressing effect on testosterone. Statins, which are for cholesterol. Slow-release opioids have also been shown in some cases to pull down the T levels. So those can be things like morphine, OxyContin, transdermal fentanyl, which is in a patch form. Even asthma inhalers and some antihistamines can also pull down your T levels, which, let's stop for a moment and think about that. So these pull down your levels, which could affect your blood test. But if your levels are pulled down, that maybe those medications are also part of what is, introducing your symptoms by way of pulling your testosterone down. Now, I don't think that if you're taking Zyrtec once in a while that's the source of your problems, but it's something to consider, like especially if you're on a daily regimen with an antidepressant or even, daily use of opioids or an asthma inhaler. It's worth considering, and you'd probably want to, discuss that with the doctor or the staff at the clinic that you go to. One of the biggest ones that we already mentioned can be lifestyle choices. So, regular alcohol use, sedentary lifestyle. So if you don't exercise, that is going to fail to stimulate testosterone. Obesity is also commonly indicated as having low or leading to low testosterone. There's different, like we mentioned, techniques used in the test in general, and so that can affect the levels. So the main takeaway here is that the blood test isn't a perfect, indicator of whether or not you're actually experiencing low testosterone. One way to help minimize the accuracy challenges is to, get 2 or 3 tests and average those results. And that'll get you a little bit better idea of where your levels actually are. But it seems that due to the accuracy challenges of blood testing for T, many clinics will simply treat self-proclaimed symptoms rather than your levels. Now, it's arguable whether this is the right approach or not. On the one hand, science, quantifiable data, blah, blah, blah. On the other hand, there are absolutely some guys out there experiencing intensely shitty symptoms that may not have blood tests to support the testosterone replacement therapy. In those cases, I'm not a fan of denying them the option for treatment based on the blood tests alone. This does, of course, create a loophole for irresponsible individuals to slip through and get on the T when maybe they don't need to, and or could benefit from some lifestyle changes first. But, I'd say that personal freedoms, if people want to get on the T, then it should probably be up to them. So there are also some potential side effects, of course. Probably the biggest concerning ones is actually a claim that there's a cardiovascular risk. So that'd be, affecting heart and things like that. The evidence and research that supports this is not strong. It also appears to be outweighed by research suggesting that TRT actually has cardioprotective outcomes and improves this aspect of your health. Personally, I suspect that most data which would suggest the increased heart risk from TRT would be due to pre-existing conditions. So, for example, a guy who's already overweight and in poor health begins TRT, both the physiological and psychological impetus to engage in exercise beyond his previous level leads to a cardiac event. And then in that case, TRT is indicated as the cause of that heart attack in some case. So maybe testosterone didn't have enough time to work towards improving his health, and that, that person was probably already at high risk and just didn't know it. And his lack of much vigorous exercise up until that point meant he didn't push his body past the threshold to experience a heart attack or stroke or whatever it may be. Now, this doesn't mean you should ignore the risk here. If you have a lifestyle and a body that puts you at higher risk, then you should definitely tread lightly and ease into the new lifestyle. Once again, making lifestyle choices that can naturally bring up your T levels before actually getting on, the therapy itself. Which brings me to another point before we cover more side effects, is that in general, most of the testosterone replacement therapies, they introduce what's called exogenous testosterone. And all that means is that it comes from outside of your body. Whereas the testosterone our body produces is called endogenous. So when we are, being injected or applying a gel or getting a patch or something that introduces this testosterone from outside of the body, our body picks up on that and then stops producing it, which can lead to some other problems we have to be careful of. There are parallel treatments and products that you can take along with the testosterone, which will help minimize the risks there. One of the main ones is HCG, which it basically helps. It's often prescribed only to maintain fertility in men, but it also has some other positive benefits, and some people say that whether you want to have kids or not on T, or maybe you already had your kids, there's still compelling reasons to take HCG alongside the TRT. So let's cover a few more side effects. Acne is a commonly reported one, or oily skin. It seems that this is mostly a risk if you experienced bad acne as a teenager. So if that's the case, and when you start up the T, if your dose is a little too high, it's likely that you'll, start seeing some pimples and things like that. I don't think there's any cases of like it being crazy bad acne like you see, some of us had in high school and things like that. But it's something to be aware of, and that you'll want to think about before going into it. Some other common side effects are obviously lower sperm count, which then can, of course, lead to the infertility. Shrinking balls. So that happens once again because when you get the exogenous testosterone, injected or however it may get into your body, the pituitary gland picks up on that and then stops sending the signal to the testicles to produce testosterone. They don't work, and thus they end up shrinking, which, I mean, whether you want to have kids or not, it doesn't seem like having your balls shrink is a good idea. And it can even, in some cases, become sort of painful. So that would be another thing that we'd want to avoid. There's a study that suggested an increased risk of blood clots with TRT. It was very specific and related to a gel that was used, and then the FDA just started forcing all forms of TRT to risk or list that as a side effect. Another potential thing you could run into, so testosterone is linked in many ways to estrogen in the body. So whereas testosterone is sort of the man hormone, and estrogen is commonly thought of as like the female hormone, we both have both. So it's just the ratio is different. So we have higher T and much lower estrogen, and vice versa for women. So there are some ways that this therapy can increase estrogen in the male body, which can lead to gynecomastia, which is just another way to say big titties, and not the kind you're looking for, the kind that are on you, or man boobs. So that's something you want to be aware of. I would say, though, that in most of these cases, these side effects are, indicating that something about the way your therapy is being applied is off. So I think, aside from the cardiac risk, all of these other ones should, I think, be able to be mitigated, with some care and thoughtfulness. But, they are risks, so you got to keep these things in mind. Another important thing to consider is that there are some pre-existing conditions that if you have them, you probably want to address them first before you get on TRT. And if you're honest with the healthcare person that's helping you, I don't even think they'll prescribe you the testosterone. Those are obstructive sleep apnea. So that's when you're sleeping, and basically it happens a lot if you sleep with your mouth open, or breathe through your mouth rather when sleeping, and the tongue kind of falls back and blocks the airway. And then you stop breathing and kind of like, wake up like a lot. And apparently TRT can worsen that. And so since sleep apnea is already bad news, you definitely don't want to make it any worse. And if you have it, look into it and get that, taken care of. There's also potential for severe lower urinary tract symptoms, such as like frequency and urgency, even enlarged prostate. So that's another big red flag that you'll have to watch out for. And your blood test will also look for, I forget what it's called, like some antigen that indicates indirectly that you may have an enlarged prostate. So if you're if you have prostate cancer or are at high risk for it, that would also be a big red flag and something you'd want to address before getting on TRT, because it appears that if you already have prostate cancer, then increasing your testosterone levels can accelerate that problem, which obviously you do not want. If you have severe congestive heart failure, which heart failure sounds like the heart just broke, but it really just means that the heart isn't working at full capacity. So if you have a severe version of that where your heart is underperforming, then stay away from the TRT and work on that first. And finally, if you have above normal red blood cell counts, that would be another contraindication or reason to stay away from the TRT for now. Let's move on to all the different ways that one can receive the testosterone. So probably the most commonly known for those outside of being currently treated would be injection. So it's just intramuscular injection. The needle is pretty small. I'd say it's probably comparable to an insulin needle, or maybe the needle you would use to drain your cauliflower ear. And that, I don't know, most people seem to see that that's like the best way to do it. There are also gels that you can rub, I think, on your testicles. There are patches that you can get. There are even pellets that can be like surgically implanted beneath your skin, and they last like 6 months or something. There's a lot of different ways to go about it. It sounds, if I were to do it, I think I'd just keep it simple and go with the old needle and not have to mess with the other stuff. So there are a few things that I did not want to forget to mention here. So we talked about HCG a little bit and how, you've already had children, or maybe you already know that you don't want children. So maintaining fertility isn't important to you. Still, it seems like taking HCG is a good idea, even though it's most often only prescribed to maintain fertility in men on TRT. We talked about exogenous versus endogenous, and once again, that just means that exogenous T is, coming from outside of the body, whereas the endogenous is what is produced by the body. Let's see. Let's talk a little bit about young guys on TRT. It seems like the levels stay the same until about age 30, and then they start to decline. But then we see cases where guys in their early, mid-20s are on the stuff. That seems to me like, I'm not going to fault the guy for doing it. If he thinks that it's right for him, then I think that's his body, his choice. If you're a guy that's in your 20s and you're thinking about doing this, I think it's all the more important for you to focus on the lifestyle changes that could potentially lead to improving this without the T. Because once you get on it, it's a lifelong choice. It's a commitment. And personally, I want to try to push that start date out at least a little farther. Right now, I think I'll probably wait till I'm 50. So I got over 10 years before I think I would personally get on it, unless I start to experience symptoms that would make me want to go the other way. There's some questions to answer too. Like, one of the biggest questions I have is, what effect does this potentially have on longevity and long-term quality of life? By boosting my physicality and all these benefits that come from TRT, by getting all of that now, am I taking anything away at the end of my life? I don't know, and I haven't formed a strong opinion on this yet, but it's something that I want to have a strong opinion about before I personally start taking it. Another question that actually a friend asked is, so if the range is, let's say, 300 to 1200, and one guy who has a level of 600 can get on TRT and boost it up, what's the problem with just cranking it all the way to 1100? I want to look into that one a little bit more and get some more details. I think it's a very rare case, but high testosterone is actually also a medical condition with some, accompanying symptoms. So I would think that would be the issue, is if we boost up too high, that we'll start to encounter those negative effects of testosterone in our bodies. So that wraps it up for now. We covered a lot of the basics and identified a few questions that I think we need to circle back on and get answers to. And these are questions that I'm going to try to get answered, via guests and further research. So appreciate everybody who took the time to listen to this. I hope that you at least know more than you did when you started, and maybe even you have a few questions of your own that this sparked in your mind. And if that's the case, definitely send them to me. I will tell you how to do all of that right after this. Thank you. All right. The first episode is done. Oh my God. So exciting. Before ending this, though, I wanted to say a couple of things. First up, this subject is, definitely not complete. I was not able to cover everything, obviously. The idea was really that this will give us all sort of a primer so that as I can get some guests on here that, have much deeper expertise on this, we'll all kind of go into that with a baseline set of knowledge so that the more interesting topics we can kind of keep up with. Ideally, you walked away from this episode learning more about TRT than you already knew, and hopefully even coming up with some questions of your own. If that is the case, I would love to hear them. So please send them to me. If you're listening to this first episode, you probably know me, so just text me or, tell me your question. If somehow you manage to find this podcast and you don't know who I am yet, then you can just shoot them to me on Instagram. My personal account is at dmulv.io. Once again, that's dmulv.io. And actually, you could also use the contact form on that website too, dmulv.io. And let me know what you're thinking, what your questions are. A new episode will drop next Monday. I don't know if it'll be on this topic for sure or not, but if it's on something different, I promise that will be equally interesting. Thanks again.